This is what St. Francis looked like when I first got there. And you'll hear me use the term we, because we accomplished this. Give you a background on it. Market, there's 2 hospitals in that community. Southeast Health, and you've got St. Francis. And competition in a 2-hospital town is about as ugly as it can get. Now you guys know a little bit about that. Interesting enough, the 2 hospitals there also spoke about a merger at one time. Actually 3 different times, and I'll tell you about that. I was the 4th CEO in 7 years. That's not real good for stability, much less a strategic plan. Can you imagine the employees? Things were really abysmal. When I got there, there was also a union campaign underway. I didn't know about it, the board didn't know about it. My wife commented to me after seeing our financials, what the attitude was like. She said, should I continue to unpack? That's, they fire the NBA and the coach in the NBA. That's kind of how she thought this was going to turn out. I said, no, we got to give it some time. There was a proposed merger with Southeast. Physicians were not a part of it, and they were very angry about that. So the docs were real unhappy, so much so that some of the profitable services, like orthopedics, GYN surgery, ophthalmology to a degree, were building a competing ambulatory surgery center. And at one time, they offered to share a third with each hospital, and the docs would have a third. The 2 hospitals said no, absolutely not. In fact, we're going to oppose your CON. That's not a good working relationship. Ultimately, we'll turn that around as well. First lesson, I would say, was accountability. It's absolutely necessary for creating a successful and consistent culture. We didn't have that in the organization. If there was budgets, for example, people do their budgets. Actually, they were given their budget, so they had no input on it. They have their budget, and most of the department managers just shoved it in the bottom drawer because nobody's going to ask them about it. In fact, one of the CFOs had in their appraisal from the previous CEO, he needed to create budget accountability. Budget variances became a reality. Anything over $500 or 5%, whichever is less, was reported all the way up. I reviewed budget variances even after the vice president summarized it. So they were reviewing them. There's a statistic called a gross margin. And basically, if you're a revenue center, it's what you can control in expenses as a percentage. Well, that became a key metric to hold people accountable. This is what the medical center looks like today. It's a far cry from that earlier picture that you saw, and this obviously does not include all of the 32 satellite locations. So I think the takeaway that I would have for all of you, the success of the organization is due to the people that you work with, day in and day out. It's not just physicians, not just nurses, because we all know if the rooms aren't getting cleaned, you're not going to be able to turn over beds, the ER is going to get backed up, and it's a domino effect. That's why the gain share program, the bonus program, was so important to all be tied together. Second, I think you need to give people the tools. A lot of it's an educational tool basis. Very intelligent people, they want to do the right thing. If you don't give them the tools, it's a little hard to ask them to accomplish something. One other thing I think is important. What you all do, and what I had the privilege to do for 39 years, is healthcare. We touch people, we touch their lives, their families. That is a remarkable sense of pride in what you all do, whether you're directly involved with patients or indirectly involved. Because you can't do that if you're in manufacturing or things along that line. Take nothing away from those other industries. But it's very, very special what you all do. And I want to thank you on behalf of all those lives that you touch, and that I had the privilege of working with staffs all throughout the country at different times in my career. and all the lives that they touched, because it's pretty remarkable. So thank you for what you all accomplish.